Welcome to sqadia.com. My name is Mohammad Osama, and today we are talking about the nervous system pathologies. And in this specific lecture, we are going to talk about the cerebrovascular diseases and the head injuries. So in this lecture, we are going to talk about infarction, cerebral hemorrhages, and head injuries as well. So let's talk about the cerebrovascular disease. So it is the most common group of central nervous system disorders, and it is also one of the leading cause of death worldwide. And in fact, it is the third major cause of death in the United States after heart disease and cancer. Now, let's start off with the cerebral infarction. So infarction is actually the death of the functional tissue because of hypoxia, leading to ischemia, leading to impaired nutrition due to either the absence of blood supply or poor blood supply, which can result in tissue or cell death. That is known as infarction. And the infarction similarly can also occur in the brain tissue or the nervous tissue as well. So it is the one of the most frequent cerebrovascular diseases, and it results in liquefactive necrosis, which also leads to cyst formation in the brain tissue. It is usually caused by arterial occlusion, which can occur via two major processes or phenomena. One is the thrombosis and one is the embolism. The major cause of the thrombosis is actually atherosclerosis due to the formation of the atherosclerotic plaques into the blood vessels which are supplying the cerebral hemispheres or the brain tissue. So thrombosis is more common as compared to embolism, and the most common or the favorite sites for thrombosis to occur is the carotid bifurcation as well as the middle cerebral artery. Talking about the embolism, it is not as common as the thrombosis, but it is because of the dislodged segment which actually occludes the blood vessels supplying the brain tissue and resulting in similar symptoms and effects as thrombosis, eventually leading to infarction. So it can be because of the cardiac neural thrombi, vegetations of the endocarditic valves, clumps of tumor cells, and even air bubbles and fat droplets, which can cause disruption of the blood supply. And once again, the most common site of embolism or for embolism to occur is the middle cerebral artery. Now, the clinical manifestations of the cerebral infarction depend on site of the vascular obstruction and the extent of collateral circulation. For example, if there is a middle cerebral artery, there would be different clinical signs and symptoms. If there was a stroke or there was an infarction because of the anterior cerebral artery, then there would be different symptoms. And if there was infarction in the right hemisphere, there would be different symptoms. And if there was infarction in the left hemisphere, there would be different symptoms. So it all depends on what type of blood vessel or which blood vessels was occluded on which side, and it would result in different symptoms in different individuals. But most commonly is, as we discussed, is the middle cerebral artery. So due to the occlusion of the middle cerebral artery, we can find contralateral paralysis in individuals. So there are those motor symptoms, and as well as the sensory deficits with aphasias in which there is an abnormality to communicate. Now, lacunar strokes are also another kind of stroke in addition to the strokes or the cerebrovascular accidents caused by either thrombus or either because of the ampulla formation. So lacunar stroke is actually because of the obstruction of the very small vessels, and this results in very small lesions, and these small lesions upon healing are recognizable as lacunae or small pits, which is why it is known as the lacunar stroke. So clinical manifestations are once again focal and are most oftenly purely sensory or purely motor. So there can be a pure motor lacunar stroke or there can be a purely sensory lacunar stroke. So a purely motor lacunar stroke involves the internal capsule most predominantly, and the purely sensory lacunar stroke most predominantly involves the thalamus, which receives different type of ascending tracts and thus perceives different type of sensations like the spinothalamic tract, for example. So if we look at this picture here, so this is an example of embolic stroke. So here we have the emboli, which is actually occluding the blood vessel supplying the brain tissue and resulting in ischemic part of the brain. Here we can see that there is plaque blocking flow to the small vessels, and that is one is again resulting in ischemic part of the brain or the brain tissue, but this is a very small localized lesion. So in atherothrombotic, there's once again thrombus, which is usually because of the atherosclerosis blocking the or occluding the blood vessel supplying the brain tissue, resulting in once again brain tissue death, or you can also call it as a stroke. Now hemorrhage is actually the loss of blood into a cavity or loss of blood into outside of the body, like for example in cases of external trauma or a cut or an incision. So hemorrhage can either be intracerebral hemorrhage or subarachnoid hemorrhage. So talking about intracerebral hemorrhage, as the name signifies, cerebral, so which means the blood loss is inside the brain tissue. So bleeding is into the brain substance, and it is most frequently caused by or associated with hypertension, which is the high blood pressure, which can result in rupture of the small blood vessels, and it is often complicated by minute dilatations at small artery bifurcations, such as Charcot-Bouchard aneurysms of the small arteries. Most often it is found in basal ganglia and thalamus, and other sites include pons, cerebellum, and frontal lobe white matter. So here you can see that blood begins to fill the space inside the brain because of the loss of blood into the brain substance. So thus it is a intracerebral hemorrhage. On the other hand, we have subarachnoid hemorrhage, which is the bleeding or the loss of blood into the subarachnoid space, which is the space outside the brain parenchymatous tissue but inside the vault of the skull. So here you can see this is the periosteal layer and this is the meningeal layer, which is actually the dura. And then there is the arachnoid layer, and then there is the subarachnoid space, and there is the pia mater. So subarachnoid space is between the second and the innermost layer of the dura, which is known as arachnoid mater and pia mater. So the bleeding occurs between the arachnoid mater and the pia mater in the subarachnoid space, or you can say it occurs beneath the arachnoid mater. So is also associated with Barry aneurysm of the circle of Willis, which can result in rupture of those blood vessels and can also be caused by arteriovenous malformations or external trauma or hemorrhagic diathesis. Now there's another condition which is not as severe as stroke, and it is not usually called a stroke, but it is a type of a cerebrovascular disease, and it is known as transient ischemic attacks, in which there are brief or small duration episodes of impaired neurological function caused by temporary occlusion of the blood vessels or temporary impairment of the cerebral circulation. So it is not associated with serious damage, and the symptoms that usually come in that patient are reversible. However, it is important to consider that these transient ischemic attacks can actually act as a precursor for other serious occlusive events such as stroke, either, for example, here, or it can also result in hemorrhage as well. Now, head injuries. Head injuries can be because of penetrating or invasive wounds, or it can be because of non-penetrating wounds as well. So when you talk about penetrating wounds, which in addition to brain damage can also predispose the brain to infection because of its exposure to the external environment. On the other hand, non-penetrating injuries can also result in brain tissue damage. One very common type of injury is the coup and contra coup injury, in which in coup injury there's actually the impact or damage is at the initial impact of concussion, and in the contra coup there is actually it is the secondary impact. It is opposite to the side of the initial impact. Now, head injuries can also result in epidural hematoma or subdural hematoma. So epidural hematoma, as you can see here, so in epidural hematoma it is usually arterial hemorrhage, so it is because of the disruption of the arterial blood flow, and it is usually associated with a skull fracture, either because of the external trauma or any other cause, and it most often results or associates with laceration of the branches of the middle meningeal artery. And there is a short period of consciousness, which is known as lucid interval, followed by rapidly developing signs of cerebral compression because of the rapidly developing or increasing size of the hematoma. So as you can see here, there is a skull fracture, and there is a red color signifies that it is the arterial hemorrhage, and you can see that dura is pushed away, and then which is resulting in the compression of the brain tissue. On the other hand, we have the subdural hematoma, which results because of the venous bleeding. So it takes more time as compared to the epidural hematoma because it was arterial. Then there are actually bridging veins joining the cerebrum to the venous sinuses within the dura, due to the rupture, which can result in venous bleeding and subdural hematoma. It is characterized clinically by gradual signs of cerebral compression because there is less pressure in the veins, and it results in the signs of symptoms which may take up to hours or even days or even weeks after injury. So the symptoms come slowly, whereas in epidural hematoma there was a short period of consciousness followed by rapidly developing signs of cerebral compression. So in this there would be slowly developing signs of cerebral compression, and it may even go unnoticed initially as well. It also can result in it can also result in volume. It can also result in different type of neurological symptoms because the volume of hematoma increases as a result of osmotic imbibement of water, because the hematoma is actually slowly increasing in size, and because of the slow pressure of the venous blood vessels, and then it also results in the you can say arrest of the hemorrhage because of the clot formation in the veins and the blood vessels. And after that, it can also increase in size and cause increased pressure on the brain tissue, but that would not be because of the loss of blood from the veins into the subdural space, but that would be actually because of the osmotic imbibement of water, which would result in a slowly enlarging tumor-like mass. So here you can see that dura is attached to the skull, so cannot cross falx and tentorium, and there is torch bridging vein, as we already discussed in this slide, and this actually occurs very slowly as compared to the epidural hematoma. So that was one of the major differences between the two. So in this part of the lecture, we talked about the cerebrovascular diseases and head injuries, in which we talked about infarction, hemorrhages, and penetrating and non-penetrating head injuries. So keep on watching other series of these lectures as well, so that you can learn more about the nervous system pathologies. And thank you for watching. Keep on watching sqadia.com.